You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic is what you need to know if you're considering any type of nasal surgery. We're talking about rhinoplasties with America's go-to plastic surgeon. Can't even believe he came on the show. We've had him on before, back in the old days. You've seen him on The Doctors, playing in over 150 countries, the most famous plastic surgeon alive, Dr. Drew Ordon.
Randy, such a pleasure to see you again.
Yeah, good stuff, good stuff. Now, I've interviewed you many times about facelifts, and people are always surprised. They see you on TV, and they don't think you're still practicing.
Well, that was a problem. I mean, the show was a great run. 14 seasons that allowed me to reach so many people worldwide as a physician, not just talking about plastic surgery, but how to help you lose weight, how to help you quit smoking, what you need to know about diagnosing skin cancer, all those little things.
You became like a super specialist in a way.
And everything.
Right?
And a lot of those anecdotal stories that you changed my life from that point of view, a medical problem, I mean, that really was cool. So that platform was really a gift from God. But to your point, yeah, a lot of people, I'd see patients in the office and they go, how can you be on TV right now and you're here talking to me?
Really? They said that?
Well, yeah, I wasn't sure if you practice or not still because you're on TV. We taped a lot of shows, crammed them into 2 days at the end of the week. So I never stopped practicing. I was always active practicing. And, although I'm sad the show is over, I'm happy I'm doing TV again with you here, but it allows me to do what I love to do, plastic surgery full time.
So rhinoplasties, do patients call them nose jobs or rhinoplasties? What do they call?
Well, I think it's like having my nose done, yes.
Nose done.
Yes,
okay.
A few people do say rhinoplasty. People are so savvy now, their heads in that internet, they know how to do a nose job themselves. They've read so much about it. But nasal surgery and, Randy, I did general surgery, then I did head and neck facial plastic surgery, then I did a formal residency in plastic surgery. So I do it all. But I must say that I chose the ENT facial plastic surgery route because of my interest in noses. From the get-go, that I knew that I wanted to be a nasal surgeon, both functionally, cosmetically, reconstructive surgery on those, all of those. I always loved the nose, fascinated with the nose. And if you ask any plastic surgeon, you've interviewed tons of them, that doing nasal surgery is so different than anything else we do.
You told me this years ago. You said that it's like the most technically demanding of all plastic surgery procedures. And you also told me, and I asked and verified this, you said that a lot of plastic surgeons don't do noses. They don't like them.
Well,
and you like them.
Exactly right. That it's so different. It is one of the most demanding. It's a totally different skill set. And some plastic surgeons, depending on their training, just didn't get much experience. I got experience during my first residency doing facial plastic surgery, so I was attuned to noses. Boom, I go to plastic residency, everybody I would see, I'd say, hey, you know what, we can do this. So as a resident in plastic surgery, I did a crazy number of nasal surgeries. So it's something I've always liked to do, and it's translated into my practice that I still love doing it.
Are there a lot of people that really don't like their nose?
Yes.
Like, what do they say? Like,
yes,
take me through a consult.
Well, unfortunately, I think the number is big, but unfortunately, a lot of these people wait too long. I just did a face neck lift with a nose on a 75-year-old in the desert. Sweetheart of a lady.
Rancho Mirage.
Okay. She was so happy. She was crying. She was so pleased. She had wanted to do her nose all her life. She'd been living with this bump, and it took her all that time. We did it in conjunction with the face neck lift. Changing your nose, taking a bump away from your nose is not only going to make you look better, prettier, more attractive, but it's going to make you look more youthful. So for her, it was very, very strong. Unfortunately, Randy, I think a lot of people don't like their nose, and they're just they may be squeamish about it. Maybe they think they're being vain about it. And, they don't jump right into it. After the fact, they say, my biggest regret is I didn't do it sooner.
Now, you're a professor at USC. You teach rhinoplasty?
Yes, the residents and the fellows are in our office, Roxbury Clinic and Surgery Center, affiliated with USC for aesthetic surgery training. So I'm there working with the residents and trying to share my experience and expertise with nasal surgery.
So these are board certified or plastic surgeons that are about to go in the real world, and they practice for a year with you?
Yes,
first?
That's what fellowship is.
Is that what it is? Okay.
Yes, they've already completed training. They come for an extra year focusing in on aesthetic surgery.
And do you speak at the national meetings, right? Because
I
of
have.
who you are.
I have.
And
for years.
You've also invented, we didn't talk about this on your, but the O-Lift, which is the Ordon Lift.
Yeah, it was my take on a deep plane facelift that was combined with some fat transfer, some fractional CO2 laser.
Okay.
It was sort of my combination, how my trademark facelift, and I called it the O-Lift as an Ordon, and I also tongue-in-cheek said I call it the O-Lift because after you have this done, they're going to go, oh my, do you look good.
So we talked about the bump on the nose. Is that a typical person, or what are some of the other things, problems that women know about?
With the nose, I mean, we can, and let's just touch on the nose, the different facial features, that the eyes allow you to look into the inner soul. The lips, the mouth express emotion, sensitivity. The nose gives you character.
Okay.
Whether you're Jimmy Durante with the big nose gave you character, or Barbara Streisand, her nose gives her a certain character. Your nose gives you character. So depending what you're trying to achieve, and if you want a prettier, more attractive, a more alluring look, then a bump, a wide tip, a wide base, a real wide nose, a plunging nose, those things aren't going to work. If that's your character, if that's your persona, then changing those characteristics is going to give you a whole new lease on life.
And so with the nose, knowing you're coming on, talk to somebody, they have a bulbous, they called it a bulbous nose, I guess kind of
a big tip.
What do you do for that?
Well, what it is
dumbing it down for us to understand.
Dumbing it down. 3 components to the nose. The upper third is your nasal bones. That's where the hump comes in. Middle third is your first set of cartilages. That can be high. Very often we do something to improve breathing in the middle of the nose. And then finally, the lower third of the nose is determined by what we call your tip cartilage. Now, if you have too much of that tip cartilage, Carl Malden, it gives you that real bulbous tip.
Is that an easy one for you to fix, by the way?
Well, get great results. I mean, it's
technically demanding, but
it's pretty straightforward that if you have a really bulbous nose, you go in there and reduce that so-called bulbosity, that will be a game changer, making you look better.
Now, I had a plastic surgeon on my show one time tell me, Randy, you only get one chance at doing the nose. That means you got to get it right the first time. Is there truth to that?
Well, there's truth to that about any plastic surgery procedure, but nasal surgery is very demanding. And sure, we're making changes. We're removing tissue to give you a smaller, more attractive nose, but it's what you leave behind that's so important. So
is that right? What you leave behind? Meaning,
well, yeah,
what does that mean?
It's the bone and the cartilage that you're leaving behind that's the end product. So yes, you're removing, but it's removing the right amount. So yes, you do get one shot. Sometimes do you have to do revisions? Yes. Fortunately, that's not all that often. Minor deformities after doing a nose, you can fine tune with fillers, actually. So our control over nasal surgery, the final result, is better today than it ever was.
At what age? What are the age ranges?
Well, the sweet 16, the girl that's getting ready to go to college, graduating from high school, it's a huge time in their lives. They're getting ready to go away, start a new life in college. So it's that category, the 16 to 18 range.
So the parents get involved.
Parents get involved, and that's a game changer. I love those
Is that right?
cases.
Okay.
Well, yeah, and you make those changes in a young woman. She's getting ready to go to UCSB or wherever she's all, and just the smile, she's glowing, feeling better about herself, getting ready to start this next chapter in her life. So cool. Then you see in their 20s, they wanted to get their noses done when they were younger, but didn't have the means, didn't have the time, whatever. They now have the ability to do it. They want to make that change and get on with life. And that goes on into their 30s and 40s.
Can it be subtle, by the way? Because it seems like
it can
everyone's going to, you show up to work and they're going, what the heck did you do with your nose?
So, I mean, if you really have a big plunging nose with a big tip, it's going to be dramatic, but natural noses. The days of cookbook nose jobs are done. Remember back in, well, you don't remember, but back in the day when I started my training, everybody wanted Liz Taylor's nose, including Michael Jackson. And he came close. But they wanted Elizabeth Taylor's nose, that elegant little national
a little bit of a tip-up nose.
Little bit of a bob, little bit of a scoop. That's what we did for everybody, and that's not right. Everybody's character is different. Everybody's nose should be a little bit different. So we listen to the patient.
Do you still see it today, though?
Well, in
Like
certain
bad
cultures,
noses?
well, overdone noses, yes.
Yeah, okay.
That and that's a whole different thing. But our ability to reverse some of those noses that were overdone in the past, those turned up little noses, by adding cartilage. Sometimes we have to go to the rib to get fresh cartilage. We can give them more of a natural nose, the nose that they want. Maybe building back up the profile, maybe giving a little more length to the nose. It's all doable. Revision rhinoplasties are a significant part of what I do with noses.
So you have a celebrity following. You do a lot of work. And I guess if you're a television star or movie star, you're on the big screen. So they must really be afraid to get something that doesn't look great.
Oh yeah, if
you do a lot of that.
Well, I have done in the past. You know, I practiced in New York City for 15 years before Beverly Hills. So those two spots, you do get a lot of celebrity clientele, and I have had my share of celebrities doing their noses. I can't say names, but you've seen them.
You say it here. My friends say
You've
nobody
seen
watches
them.
the show.
Grammy award-winning singers, men and women, different ethnicities I have done. They are out there, and sure, they're in the limelight. Their close-up photos are on the cover of their albums.
Does that make you a little nervous?
Yeah.
When somebody is in the public eye?
That is pressure, yes. You have to deliver, but again, it comes with the training, the experience, the confidence of having done literally thousands of noses of different types, and stayed attuned of the latest and greatest techniques. You have to understand, I did thousands of noses closed technique without making an incision here and opening everything up before I sort of switched, which is now over 20 years ago. So I still do both, and there's very few plastic surgeons that are experienced and trained in doing both, what we call a closed and an open technique. But trust me, Randy, you've seen my noses out there.
Is it one of those things that experience, like, even more so than any other plastic surgery?
100%.
Like, you're
more
better
than
a thousand of these later. You're better.
Hands down, the most difficult thing to train, because it's such a closed little space.
So if a young plastic surgeon says, Dr. Ordon, what's the key to a natural-looking rhinoplasty? What are the keys?
Well, the keys: a natural looking look, a nose that doesn't look done, a nose that balances well, is in harmony with the other facial features. So depending on what they want, it's typically a straight profile, a nice narrow transition from the nasal bones to the tip, finally a refined tip with what we call the right facets and light reflexes, and then finally an angle. For a woman, that angle should be anywhere 95 to 100. For a man, somewhere 90, 95, something like that. So there are proportions. There's a ratio of proportions that are really important with the nose, and we weigh all of those things based on what the patient is trying to
A lot of
achieve.
people don't like their noses, but they do nothing about it. What are their fears on that consultation? What do they tell you? Like, what are they afraid of? What holds them back?
I think one of the big things is I think they're afraid that it's going to hurt. And Randy, I'm honest with you that rarely do rhinoplasty patients complain of post-operative pain.
They're worried about the
I mean, when
pain?
you get whacked in the nose, sure, yes, that hurts, but we do this under controlled conditions. You're asleep. We inject adrenaline, lidocaine, so that everything is constricted so it doesn't bleed. We immediately put a cast and tape on so it doesn't swell. So everything is very, very controlled. So pain, discomfort really is not that big a deal. And then the second thing is, I guess, is being concerned about the result.
They don't want it to look fake.
Yes.
Is that what they're
and
saying?
Consultation nowadays, I see you, we talk about what you want, we take your picture, and we do computer imaging morphing with an app that we use, New Look Now, that I love, that they, based on, well, they want a conservative reduction of the bridge, leaving them with a straight profile. They want moderate reduction of the tip. They need narrowing of the
So on the computer,
nasal.
you could just show them what they're going to look like?
Yeah, we get a rendering, a beautiful photo that we share with them.
Are they ever surprised? Like going, really?
Yes, and it's a great starting point to complete that consultation. Like, I want a little more, I want a little bit less. You left me with straight, can I just have a little bit of a scoop? So it really is a powerful, I mean, I was one of the first to use computer imaging with noses back in the mid 80s, and it's still similar type thing, but now we use an app and we use a service that does it.
Do you ever fix people that had a so-called bad nose job?
Yeah, Randy, anyone who does a lot of nasal surgery like I do, revision surgery is a large part of it. And, it can be...
Do you like it? It's tougher?
Well,
What is
it's
it?
tougher, especially, third time, fourth time, fifth time. I've been there.
Okay.
And the tissue gets more scarred and more difficult each time you do it. But so much has been learned about what we can do with reconstructive redos, taking cartilage from the hip, taking fascia from the temporal area to smooth irregularities over. So for most revision cases, improvement is doable. We can't, a lot of times we can't undo it altogether. We're talking about noses, and we're talking about life changes and physical changes, but they translate to those psychological changes. I see it both, men and women. They come back for their 6 month or their 1 year, and they're, hey doc, I got engaged. Hey, I'm dating. I'm at UCLA now, and I have a great boyfriend, or I have a great girlfriend, and I'm busy, and I'm going to all these parties, etc. So I get those stories all the time, and those patients that had their nose done at a younger age.
What's the fastest you've had a patient after a rhinoplasty go back to work?
Okay, yeah, I've done professional people, and some people push the envelope. They had a commercial come up. They wanted to shoot it. They actually were on camera in a matter of weeks. But Randy, you have to understand, after rhinoplasty, you will have tape and a little cast on your nose for 6 days, so about a week. At that point, you still have some bruising and swelling. But when that comes off, and I've seen it, that cast and tape come off, very little bruising and swelling. I've had people go back at 1 week.
So 2 weeks, you're fine for sure.
2 weeks, yeah. I prefer to retape the nose after 1 week. It just reminds them not to bump their nose. It keeps the swelling down a little bit. But 2 weeks, you're good.
What do you want people to know about rhinoplasty in general? Like, if you were educating people, like on the show, The Doctors, what do you want people to know? Like, what
you know, it's pretty cool. I did a lot of noses for The Doctors. Primary rhinoplasties. I did a bunch of the producers for the show who had breathing problems. So a lot of my work, I did highlight one case, a nasal reconstruction. A woman had her nose bit off by her boyfriend. So we did a forehead flap that we did and actually rebuilt the nose. One of the coolest things I did for The Doctors. That is a difficult, challenging procedure. She did very, very well. And I tried to share this with those stories, what to expect. I think the biggest take-homes I want to tell you is that the discomfort, downtime are not as bad as you think. They're minimal.
Does some patients say it didn't hurt at all?
Absolutely. Didn't take any medication. You gave me the Percocet, I didn't take one.
Okay.
I hear that all the time because it's so controlled, getting you ice going, arnica, other things you can do, minimize bruising and swelling. And then number two is that nasal surgery is so much more predictable, that in dealing with somebody who's done many, many thousands of them, experienced, gets the nuances, you have a chance to tell the surgeon what you want. I'm not going to dictate, you're going to have a Elizabeth Taylor nose. We're not doing that. We're going to give you the nose that you want. And now more than ever, it's predictable. We can take your photo, give you an idea of what you're going to look like.
Show them on the computer.
Yes. And I can never guarantee exactly like the photo. Very often it's better than the photo, but pretty darn close.
How long does it take you to do the surgery?
Primary rhinoplasty, every case is a little bit different. It varies, 2 hours, 2.5, 3 hours, something like that.
And the first night is okay. They're able to breathe all right. Downtime's not too bad.
Nowadays we don't put in that heavy packing. We put in a small nasal splint to keep things straight, but you can breathe around that. So in the old days, people were horrified the fact that they wouldn't be able to breathe through their nose immediately after surgery. Those days are over.
And so would you say there's like at least, there's 26 million people, I think, in the LA County area. There's hundreds of thousands of people that hate their nose that are doing nothing. What do you say to them?
I say,
and really, it's the people that don't like their nose.
I said, what are you waiting for? And I hope this has given you some good information. It's all about information, answering some of those questions you have. I think I've addressed what most people consider their biggest obstacles before they jump into having their nose done, but we're here for you.
Do you have any frustrations? I'll put you on the spot here. What frustrates you about maybe what's going on in plastic surgery today? You're a key thought leader on these topics. Is there anything that frustrates you about what's going on with noses?
Well, with noses, what frustrates that I think people think that there's going to be a lot of downtime and discomfort associated with it, and that it isn't predictable, that based on a consultation and renderings and things like that, that we can come in pretty close to what you're looking for.
And the consults, they see you on the consults?
Absolutely, yes.
And
some I do, if you're out of town, out of country.
You can do Zoom?
Oh yeah, we do, yeah. We can do FaceTime, for a nose, anything on the face, that's very good.
Because you do all of the procedures as a plastic surgeon, is rhinoplasty one of your favorite?
It really is. And
is it the favorite?
It's right up there.
Okay.
Along with face, neck lifting, facial rejuvenation, I have to say that rhinoplasty is my favorite thing to do. And as we started this conversation about noses, nose is one of the reasons I pursued a career in plastic surgery. That
Really?
I liked the nose. I wanted to do nasal surgery, rhinoplasty. I just found it artistic and challenging and game changing. That for people, we don't realize that people, they have certain things they don't like. They really focus in on it a lot more than sometimes we realize. And even though if it's this relatively small thing, now there you have to be careful. If somebody's obsessing about something that almost isn't there, then that's a red flag. But in general, even a small change on the nose, to them it's a big deal. They're focusing on it. It's affecting their life. It's affecting the way they perceive themselves. Boy, you make that change, it's a whole new person.
They're blooming.
They're blooming.
Has it become that much more mainstream? Is that another thing that you've seen? What used to be...
I think so. Well, but Randy, look at everything, social media, and they're obsessed with showing before and after pictures, and plastic surgeons, it's a big competition who can create the bigger Brazilian butt. Boom, boom. I mean, it is a feeding frenzy out there with plastic surgery, aesthetics, just the whole market. And you know, I'm a little old school. Sure, I have to do some social media.
You want natural results. I mean, we've
well,
talked
I want
on the phone.
natural results, and you know, I'm a little bit old school. I think social media can be a little gimmicky, and this is why I like good old-fashioned TV, and this is why we're doing it.
Good, good. Now, I have to ask you this. People are injecting. They're saying you don't need rhinoplasty. Just inject it with fat or filler, etc. Can you?
Injection rhinoplasty, that is a real thing. We don't use fat in the nose. We use different types of fillers. There's radius, hydroxycalcium, appetite. There's the HA fillers. Great for minor little defects. If you have
like what, dents or what?
Dents. If you want to build up the nose slightly, great thing. If you have a bump, if you inject a little above and below, you will camouflage that bump. Yes, I mean, it's counterintuitive. Okay. By adding, you're making your nose a little bit bigger, but the camouflage effect above and below, leaving a straight line, will eliminate the bump. Now, you have to understand, it's temporary. If you keep repeating it with these fillers, it may become permanent at some point.
Oh, really?
Yeah.
Do you ever have people that come in and they think they need nasal surgery, and you say, you know, I think with a little filler above and below the bump, we'll take care of it?
Yes, we see that. We also see people like, can you fill it first? I want to see if I like it. And if I like it, then maybe I'll go for surgery. So we see that too.
So you do both. Dr. Ordon, I want to thank you for coming on the show. Always great stuff. Pleasure and an honor, actually.
We could go all day long. We could talk about whatever you want to talk about. We haven't done any body yet today, which I do as well.
You do a lot of like mommy makeovers,
mommy
tummy
makeovers,
tucks,
still do breast surgery,
breast lifts.
Breast lifts, breast reductions, post-weight loss, body lifting. Still love doing that. Just spent 6 months in Miami where I did a lot of body contouring, a lot of Brazilian butt lifts. Big down in Miami. I learned the right way down there.
Is that
You're
right?
never too old to learn.
All right, great. Thank
Thank you.
Good stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.